Hi, this is Dr. Bob Dannenhoffer. We're working today from my home studio, so we started a minute or two early, 2 minutes early.
You're not coming up.
Good. Hi, this is Dr. Bob Dannenhoffer. Working today from our home studio. So we started a minute or two early so that we can get all the bugs worked out. We usually have a crack team working with us during the time, but I'm doing this here with my wife, so we may have a few glitches, so I'll apologize in advance. It's a lovely Memorial Day. Again, we're going to wait right till 6 o'clock, and then we'll get started. Our house has lots of chime clocks, so at 6 o'clock you'll hear it chime 6, and then after that we'll start. How's it sound? Hi, this is Dr. Bob Dannenhoffer, doing another round of Facebook Live events. It's a Memorial Day today, and I gave everybody else the day off. So I'm doing this from my home here, and you can see that it's probably not the great quality that it is when we're in the studio, but hopefully you'll be able to do it. I don't expect very many people to join us. I'm sporting my new white balaclava. I'll take it down so those people who read lips can hear what I'm saying. So again, this is Dr. Bob Dannenhoffer, Public Health Officer in Douglas County. We're doing a Facebook Live. Today is May the 25th, Memorial Day 2020. Memorial Day is a very special day where we honor those who have given the ultimate sacrifice for our country. This holiday was started back after the Civil War, and really after the Civil War, and really celebrates and honors those who gave the full devotion to our country. It's also a somewhat somber day because the pandemic continues. Throughout the world, there are now 5.6 million cases. You know, when we started doing this, we had less than a few 100,000. Now at 5.6 million cases, that is just horrifying. And there are 350,000 deaths. The disease is still very active, and especially very active in Brazil. There were some heartbreaking shows today about Brazil that shows that they're probably only testing about 20% of the people in the hospital, suggesting that the numbers in Brazil are way undercounted. Even with that, it's still a very, very active infection with the second highest worldwide case count. Russia also continues to be very active. There's a lot of concern in Russia also that cases are being undercounted. We're also seeing a rapid rise in cases in India, and India is very worrisome, a very populated, very densely packed country. And we're afraid that when this disease takes off in a place like that, it could spread very, very quickly. So throughout the rest of the world, this pandemic is really quite worrisome. In the U.S., we're at almost 1.7 million cases and nearly 100,000 deaths. You know, we had thought that the death toll was going to be 60 or 80,000 by the end of August, and here we are still in May, and we're already at 100,000. And not slowing down. So it's still very active in places in the country. There's only 10 states in the U.S. that have a decidedly declining rate. Thank God Oregon is one of them, but there are a couple of other states throughout the country that are still seeing big increases. So for example, in New York and New Jersey, they're still seeing over 1,000 new cases a day. Well, New York is a big place. It's not that big. It is about 5 times as big as Oregon, and they're seeing 100 times as many cases sometimes as we are. We're also worried about the cases in Georgia and Arkansas. These are 2 states that have kind of opened up already, and we're starting to see a big increase in cases there. there is enough volatility in the numbers that it's really hard to say that this increase in numbers is due specifically to opening up or not, but it's a big worry. Oregon really has been very quiet. It's been our lowest week since March. So our number of cases have been averaged in the 40s over the last week, and this is even counting presumptive cases, which sort of inflates the number. And so really this has been a very good week for Oregon. The question is whether does this represent what happened with reopening, and probably not. Because let's say on the 15th, you, with reopening, went out to a restaurant, got infected that day. Typically you wouldn't have symptoms for 5, 6, or 7 days. So you probably wouldn't have symptoms then until Thursday or Friday. You'd probably wait to see what this was for a couple of days, then you might seek a test, and you get a test and take a few days to come back. So we don't think, if there are new cases associated with reopening on the 15th, we think we're going to start seeing those tomorrow. We have been very carefully looking over the weekend. We have people working all weekend looking at these numbers, and there were still no new cases in Douglas County to get us to Douglas County. So no new cases in Douglas County again. We're still just at 25 cases, 23 recovered, and there's still one very ill fellow up in Portland, but everybody else is doing reasonably well. Again, we've had no new cases, and we have had enough staff working here for a while that we've been able to help other counties that are a bit more overwhelmed. So Marion County in particular seems to be a bit overwhelmed, and we've tried to help them. So we'll take your calls and chat things, put them on the chat line, and my dear wife Annie will send them to me, and so we'll go ahead and answer those. Let me get the first question here. So the first question, Deanna says, kids from different houses playing together. Is that part of the place we are in? Well, I think kids from different houses playing together probably can get done. I think, the concern is that if you have a lot of kids or a lot of kids over a space of time, that's probably problematic because we think 15 minutes of close contact, like kids would get when they're playing, is considered a close contact. So imagine if you play with 3 kids one day, 4 kids the next day, 7 different kids the next day. You could have a lot of different contacts over the time. This is the time probably to pick a best friend or 2 and get together, but that would be totally within the guidelines, I think, for kids to be able to do that. For daycare childcare is going to open up again, and what we're doing in childcare is we're cohorting so that the groups of kids in childcare will be at most 11 other kids. So if there is an outbreak, you'll know the 11 others you were with, rather than having drop-ins for a day or drop-ins for a week. That's going to be a while until we get there, but childcare is allowing 11 or 12. So I think if your kid has a friend or 2 or 3 that they want to play with, I think that's fine. It is really hard to enforce social distancing in kids. It's pretty hard in adults we see, but it's really hard in kids. And that's why just probably limited exposure is probably the right thing to do. The other thing is if you're sick, get tested. So Carol says, my mother is meeting her new cardiologist at Shore Heart Center. That's great. I heard they're getting new cardiologists. I haven't met them yet. Will my dad and I be able to meet with her as well? And I think yes. I think in the hospital they were still really concerned about people meeting because of the need for somebody visiting somebody with COVID to wear full PPE and wearing that and using up that PPE that's single use and disposable. I think meeting in a doctor's office, typically you would presumably everybody would have masks on, but other than that, I think you can get back to going to the doctor's visit. I think, up to 10 in a room would be okay. That kind of exposure, you could easily the spectators in this case could easily sit 6 feet away. And again, sitting 6 feet away would be considered not a close contact. So Zay asks, how do you feel about the soft start we're in? A lot of people seem to be careless. Yeah, so, we're in the phase 1 here. Actually, I think people have been pretty good. I went out for a long bike ride today, and then I went to get stuff for groceries for dinner, and I thought people were doing a pretty good job. I didn't see a lot of carelessness. There was some. There weren't enough people wearing masks, and there were some people a little too close. But I think in general, people are doing well. As we get a little later, I'm going to do my little golf analogy here, and I'll show that we don't have to be perfect with this. Because you don't have to be perfect, and I think some people get so frustrated when they see other than perfection in following the measures. And I will tell you as an epidemiologist, it'd be great if everyone was perfect, but we realize that you can't be. So Sandy says, can freezing kill the virus? Actually, I do not know the answer to that. Most viruses, you can't actually, because for most viruses, if you get them cold or freeze them, they come back to life. You know, viruses are not really living organisms. So viruses are combinations of proteins, lipids, and RNA, and they by themselves don't live. They only live when they can get inside of cells and hijack the cellular mechanisms. And so I do not know if freezing will kill this virus, but it's something for me to look up. Heat does kill this virus. So like many things, when you get them hot, you disrupt the lipid envelope, and when you disrupt the lipid envelope, the virus is no longer viable. So Annie says, when do you feel it will be safe for nursing homes to open again? I worry about my 97-year-old mother being exposed by visitors. This is one of the hardest parts of this whole pandemic. And we have elderly relatives. We know that they're not going to be around forever. And one of their great joys is visiting their kids, their grandkids, their great-grandkids. And I certainly know my mom is in that situation where she doesn't really want to see me that much, but she really wants to see the kids and the grandkids. And so, you know, this is heartbreaking not being able to be there. I think, however, until we have this a little bit better under control, I think in-person visits in nursing homes are really dangerous because we know that this disease, when it gets into a nursing home, really can kill. So I think we still need to be cautious. The hope, though, is that over the next few weeks, when we get better and easier testing, that we'll be able to do it. So Kenner asks, can I hug a family member in another household? We would both wear masks. Is that safe? Well, it's not the safest thing. So the safest thing would be to do namaste or to go at a distance. A hug is a moderate risk thing. So again, when we talk about it, we talk about distance, we talk about exchange of fluids, and we talk about the time. So the time, the distance, and the exchange of fluids. So even 1 minute of doing CPR on somebody, you're very close, lots of exchange of fluids is a big deal. In general, exposures that are less than 5 minutes are considered to be safer. Exposures that are more than 15 minutes and certainly more than an hour are considered to be high risk. So that would be a lowish risk exposure. So I was watching that golf thing yesterday, and I came up with a great analogy for doing it. So when you think about getting a disease, most people think it's like this one little virus that travels across the room, lands on in your nose or in your mouth, and then you're infected. And it's really not the way it goes. So what happens is when I talk, especially or I sing or I yell, there are these little droplets that come out, and these little droplets have a few viral particles in each of these droplets, and then they'll land on me. Well, it takes a bunch of these droplets actually to make me sick. 1 droplet, 2 droplets, 10 droplets probably won't, but as you start to get more and more numbers, you will start to get a higher and higher risk of doing it. And again, the closer you are, far and away, the more droplets. You remember my little spraying thing. Once you get 6 feet away, there's not much spray that made it onto the wall, but at a foot, there was a lot. So as I was watching this golf yesterday, I was thinking it's sort of like putting, right? So to get infected, imagine these little viruses out there, all with their little putters out there on golf balls trying to get in the hole. And once they got 200 balls in the hole, you got infected. Well, if they were 1 foot away, they'd make almost every one of those shots. At 6 feet away, it's a little less. At 20 feet away, it's a lot less. And at 100 yards, you could only do it if you're Tom Brady. So, and it would only be 1, right? So what's the chance that Tom Brady could do that 100 times? Pretty low. What's the chance that Tiger Woods could make 100 putts from a foot? Probably 100%. So it's distance, it's time. Some of it is luck. You know, there are some people who have very close contacts, even in the house, and don't get it. And then other people have more distant contacts. But again, it's time, exchange of fluids, and it's time, exchange of fluids, and closeness. So those are the 3 things we look at. So a quick hug, probably a low risk thing. And one of the ways I think about this is that if we're doing contact tracing, so you've got the disease now, we're trying to find all those people we need to contact to tell them to stay home and quarantine and whatever, and we work with the closest contacts. So let's say it was me, they'd say, well, Bob, which were these really close contacts? I said, well, I've had really close contact with my wife. We've been together the whole time. And so she would clearly be a contact. My kids were here at dinner during the week, but they were 6 feet away. We didn't linger over dinner, and we didn't have any specific exchange of fluids along the way. So they would be low risk contacts. I'm at work with people, but we're very good at social distancing, so I don't think I have any contacts there. And that's the thing they would look at. So let's say they would look at you and they'd say, I hugged a family member in another household. They'd say, well, tell me more about that. You say, well, I just gave him a quick hug, we both had masks on, and then we separated. We'd say, well, that's a relatively low risk contact. Now, if you said we hugged and kissed on the lips and then had this face-to-face conversation for 20 minutes, that then would be a high risk contact. So again, the chance that you'd exchange fluids from a quick hug, both wearing masks, pretty low. So Angela says, how do you feel about Ross opening? The line was around the corner of the building, no social distancing or masks. Can that affect the reopening? Well, I know that there are probably some people who've been desperate to get to certain stores and they wanted to do that. I saw also the bottle drop, there was a big long line. And so some of that is bad behavior. Really, people should be wearing masks. Really, people should be social distancing in the line, and can affect the reopening. The way it's going to affect the reopening is we'll start to see a surge of cases. And then you'll say to someone, well, go through your contacts. I said, well, I waited in line for 30 minutes at Ross, and we chatted with a bunch of people who were in front of behind me. They were all within a foot or two. That's going to be really hard contact tracing to do because you may not know those names, but again, 30 minutes in line, a foot or two from the person in front of you and back of you, you've all been exposed. So again, that's the way I think about it. I think about when we do contact tracing, how hard will this be? All right, so Dorothy says, do you think we'll have any problems going into phase 2? Well, right now, not. So to go into phase 2, there's a bunch of things we need to do. We're on track for all of those. We need to have adequate contact tracers. In fact, we have very adequate contact tracers. We're loaning them out to other people. You have to have a declining case rate. Again, we have almost no cases. You have to have a hospital rate of less than 5. We have a hospital rate of, for cases in the last month, of less than 1. And so I think we're right on track. However, we're probably not going to make that decision until June. So there's another whole week to go before we are going to start to make that decision. But I think right now it looks okay. So Shannon says, my daughter works at a gym. Is she at higher risk due to people breathing heavier when they work out? And the answer is yes. And so there have been some elegant studies now looking at this droplet formation, and it turns out that just quiet breathing gives you a little bit of droplets, maybe out to a foot or two. Shouting or singing actually gives you quite a lot of droplets. Heavy breathing like you would when you were panting or grunting would be almost as bad as coughing because they really go out a long way. So I think what we're asking for gyms to do when they reopen is give plenty of space. We're asking for your daughter not to be around those people who are breathing heavy. We're talking about people not, for example, spotting as you lift. You can imagine if somebody's lifting and grunting and you're standing over them, there's way too close and way chance of providing that. But I think in a gym, if you maintain distance, I think for people breathing heavy, 10 feet is probably better than 6. So let those people grunt all by themselves and leave them alone. Again, these things don't probably stay airborne. They probably get to the ground within a few minutes. So if somebody's done with the machine, they should clean it off, wait a few minutes, have somebody else do it, and I think that's okay. So Dana says, I use a laundromat. How do I stay 6 feet away from others? That is really hard. So there are a couple of places where it's really hard to maintain social distancing. One of those is like at the post office, I know they're trying, or at a store sometimes in line where people are crowding up. Laundromats are especially hard, and I don't have a great answer other than perhaps doing it at a time when there are a few other people there, maybe early mornings. when there are a few other people there. And I think I've noticed that people are pretty generous. So you say, hey, could you back off a little bit? Most people have been okay with that. There was one person that I got a little close. I was like, could you back off? And they were like, oh, I'm sorry, I didn't recognize. And they backed off. I guess I look old enough that people were worried. So Zay asks, when will phase 2 happen? And what determines for us to go to phase 2? If the earliest we would do it would be 21 days after phase 1, which would be June the 6th. And the factors are number of cases, number of hospitalizations, adequacy of PPE, adequacy of contact tracers, and adequacy of being able to contact all of those people who've been contacts. So far it looks great, but I can't predict the future. And so, we had 30 cases next week. That would be hard. So, for example, Marion County had 11 cases today. And if we had 11 cases in a day, Marion County is a bigger county, but not that much bigger. If we had 11 cases a day, we would not be able to go into phase 2. So still, people are doing a really good job. I would just have them continue to do those good jobs. We've got a few other information here while I just write up questions. One is there's now 10 vaccine trials that have made it to the human stage. This is pretty amazing. Vaccines usually take a long time to get there. And so to have 10 in that area is pretty darn great. So we're hoping they're going to work. All the time with the vaccines, though, we look to see antibodies, whether antibodies actually going to protect you from disease. Are they going to be long lasting? Those are the kind of questions we don't know. I looked at some studies this week that suggested that the antibodies fall off pretty quickly. And so with antibodies that fall off quickly, that is a concern. The vaccine will be really hard to develop. We're going to do a lot of tests, again in Roseburg on Tuesdays and Fridays, and so we're going to have a test tomorrow. So again, anybody should get tested. Anybody who's symptomatic, anybody who's asymptomatic who just wants a test, anybody who is a pre-op, those are the ones we're doing. We went to Reedsport over the weekend, and there were a bunch of people who did it. We would still have you have a doctor's order, but if you don't have a PCP, you can call. I'm going to go back to my numbers from last week. 541-459-3788. That's 541-459-3788. And somebody at Aviva will have to take some information, but then they'll go ahead and arrange for a test to be done. And as I said on Friday, there was somebody who was kind of desperate to get a test, and they called me in the morning, and by 1:45 they had their test. Now, we're hoping that these tests get easier. So we went over to Reedsport over the week, and the people over there wanted to learn how to do them themselves so that if they had a pre-op or something, they could do it. So I showed them how to do it, and actually they did it on me. It is distinct. It's like the third time I've had this done. It is a distinctly uncomfortable test, and as long as the tests are that miserable, it's going to be hard to see how we can get enough people tested in a short time. There were some of the people we tested, get that damn thing out of my nose. I'm never going to do that again. And that would be a concern, because I would hope that if these people got sick, they would come back for another test. So we really have to find out a better way to do it. The good news is I think we're making progress with saliva tests. And as you remember, I think 8 weeks ago, I said what I wanted for Christmas this coming year was a spit saliva test. You just, every week you get delivered to the house 7 shot glasses with some special mixture in it. You spit into it, you let it go, and then take your shower when you get out. If it's red, you've got it. If it's green, you're good to go. And do that. And once we did that, we would clearly be able to get enough testing for everyone. We're a little far off from that. I mean, there's nobody, these kits that we're doing now are still very complicated. They're complicated. You spit in the thing, which is easier than getting your nose swabbed, but still it needs to go away. It's still a PCR test, which is a very complicated test. And so we're hoping that soon we're going to get a much easier, much quicker, and much cheaper test, right? Because these tests now cost, well, they charge $200, but it probably costs them well over $100 to do. And so for me to do this every day in a month is for me and everybody else to do it every day, it is a lot of money, right? So it would be, as I'm figuring out here, it would be something like $30 billion a week to do that testing. That's a lot of money. So I think we need to have a quicker, easier, less painful way to get it done. So is there a point where we could expand the number of people we were close to and spend time with? Kenner asks. And the answer is absolutely. So, we went from a 10-person gathering to a 25-person gathering. I think we'll at some point get to a 50-person gathering. And again, it increases your risk. So if I stay and my only contact is my wife and her only contact is me, we don't have a lot of contact, so our risk is pretty low. If I start inviting the kids over and start going to parties and going to the bar and whatever else, then it'll increase my risk. I think with the low number of cases, that's, everybody has a different risk tolerance. So everybody's got a different risk tolerance. There's some people who say, look, I am so scared about this disease, I don't want to do it, and they'll stay in. There are other people, cavaliers, say, well, I'm young and healthy, I don't care too much. What I'm hoping is that the people who cavalier are not quite as cavalier. I saw some really terrible look at things over the weekend. This bar in Texas was just crowded with people. And again, think of me from a contact tracer. Somebody comes down with it now, and they come down with their symptoms on Monday morning. We'll say, okay, in the 48 hours before this, what did you do? And they say, well, my symptoms started Monday, but Sunday, I went to this big pool party with 50 other people. I don't really know who they were. On Saturday, I went to the bar with 100 others at the bar. Think of how incredibly difficult that would be to trace. So, that's a super high risk lifestyle. But if you were going to say that your life was, you're going to have a dear friend over for dinner, or you're going to socially distance, I think you can do that. So Bonnie says, if I spray Lysol or Febreze into the ear, will that kill the virus? I don't know the answer to that, but I don't think so. You'd really have to have a high enough concentration of Febreze or Lysol that it would be hard. Febreze and Lysol work best on surfaces where this stuff can wet a surface and get it there. I don't think it would work in there, but I'll look that up too. There's going to be lots to do. So Brenda says, where can we sign up as contact tracers? Well, here's the great news. So for contact tracers, we finally, state's been a little slow in getting this all together, but finally I think they have a plan together to get and hire contact tracers. And in Douglas County, we're way ahead. We've already hired quite a few, and we're looking to hire more. We're especially looking for people with special cultural competencies, especially people who might speak Spanish, or people who would have ASL, American Sign Language. So we're looking to do that. But we're in the next week going to go ahead and talk about signing up for contact tracing. Actually, the state has an interest form. So if you go on the OHA website, they have an OHA contact tracer interest form, and I would put that down. As I said, we were a little ahead of the game, so we've kind of hired all the people we need. But when we talk to the counties around us, they're not even close. So there may be jobs in those other counties. Yeah. So Bonnie says, what's Oregon doing to stop people from California and Washington from vacationing here? I've seen a lot of campers over the weekend. And actually, I did too. So I saw a lot of Washington and California plates. And I don't know if these were people who were traveling through, or there were people just have moved here and changed their licenses yet. But I did see quite a few of those. And that really is a concern, because as you move disease, and in California had 2,000 cases today. So as you move disease from one area to another, that is a problem. The governor has asked for people not to travel more than 50 miles, kind of mean stay in your own county here. And I think Oregonians have been good with that, but I don't know what you can do with people from out of state. I mean, unless we're going to have roadblocks or something like that, that's going to be hard. And I think we have to rely on people's good judgment to say, look, you're coming from California where there's a lot of cases, leave it there. If we had a lot of cases in Oregon, we would want Oregonians traveling to other places and bringing the disease there. So I don't think there's a good thing to do. Now, if you come from California and you want to go camping in beautiful Oregon, and you do good social distancing. I mean, camping is great social distancing. Remember, the transfer outside is pretty low. So remember these putting things here. Being outside is like putting in a strong wind. It's a little harder than putting indoors. And so that if people camp, maintain their distance, enjoy the beauty of Oregon,
that'll be okay. My concern is that they need to eat and they need to go to stores and whatever else. And then if they're not following good social distancing rules, that can bring the disease to Oregon. You know, when we look back at our 25 cases, about half, we think, can be traced to an out-of-state contact. So we had people who traveled from amusement parks, we had people who traveled from California, we had people who traveled from Tennessee, we had people who came down from Seattle, and we think that's where many of these cases in Douglas County came from. So this is a concern, but I think in our country, we're not yet ready to do roadblocks to keep people away. I want to tell you that our hotline is still going, 541-464-6550. We've scaled it back a little bit, but we're still taking all of those calls. Turned out last weekend the state gave our numbers, the hotline for the entire state, and so we took a lot of calls then, but it was still taking good calls. There's lots of questions that people have about contacts and opening and whatever else. So Dinah said, I thought there were some quick tests out there now, guess not here. And the answer is there are some quick tests. And I wish they were better. So there are, when we're talking about quick tests, there are two kinds of quick tests. One is like the Abbott ID Now or the Cepheid or the BioFire. This gives answers within an hour or so and uses the PCR kind of technology, so that complicated nuclear technology to tell what goes on. And yes, we do have some of those here in town. So the VA has one, the Cow Creek has one, the Mercy has one, and we're using, in fact, our last case was diagnosed using the Abbott ID. So that's a good sign. The bad news with the Abbott ID is that there's controversy about how accurate it is. The company says it's really quite accurate. The FDA is cautious. They said it may only be 50% accurate, which would be not very accurate. It was only 50% accurate, and they recommended that if you have a negative test on the Abbott ID, that you then have to have a regular test on one of the other ones to confirm the negative test. That obviously ruins the value of the negative test, right? Because you want to have this negative test and think you're negative. And so that's a worry. But this is still a very controversial area. Now, the other kind of test that's coming out is an antigen test. Antigen tests are tests that have been out there for a very long time. So the antigen is a protein or usually a protein associated with a germ or a condition, and you can do these tests that look for that protein. And that's the basis of the pregnancy test. And boy, those are quick, easy, cheap. Buy them at the Dollar General, 2 for $1. I mean, they are really easy, quick to do, doesn't take any training. You pee on them, and a few minutes later, you know if you're pregnant. And so you could have a quick, easy test like that. And there's one that got approved. We don't know how good it is. But if you had an antigen test, these are easy to make. They're relatively cheap. They're relatively fast, and they don't require anything big. That would be a great deal. And so there are some quick tests here in Douglas County. The real quick ones, the antigen tests, they're nowhere. But the quick tests are there. I think Mercy's using them in a very reasonable way. But they're not going to be the answer because of their low sensitivity. Okay, well, this is pretty good, 30 minutes, which is usually our time. So I'm going to look about Lysol and freezing to see if there's anything going there. Again, we're continuing to test. If you think you want to test, you can either call your doctor and get it done, or if you don't have a doctor, you can call 541-459-3788. That's 541-459-3788. And if you want to go on the hotline, that's 541-464-6550. We'll do this again on Friday. I was amazed that we had this many people on a holiday Monday, but hopefully it worked reasonably well. And I have to thank my wife who helped me out greatly on this. Again, this is Dr. Bob Dannenhoffer, Public Health Officer from Douglas County. Thanks so much.